Hi there, I'm Kelly Dean from the Tummy Team, and we're going to talk to you today about understanding your self-check of a diastasis recti. The Tummy Team specializes in functional core rehab, specifically online functional core rehab, and we work a lot with a condition called diastasis recti, separated abdominal wall, and this is often a condition that goes undiagnosed or misdiagnosed. And we have several videos on our site about how to self-check, how to check yourself, which is important for you to do a little bit of self-diagnosis, but also as you go through a rehab process to see how you're progressing. And it's one of many things that we do to kind of see your progress. It's not the only thing going on, but it usually is a pretty objective way for you to go, oh, this feels differently. A lot of people are very uncomfortable checking themselves, and whether it's because they're not sure if they're doing it right, or if it feels tender, or they're scared, or they feel emotional when they touch their tummy. I just want to encourage you that it's really important for you to be kind to yourself, kind to your body, and also to connect to yourself and to understand what's going on. This is your body, okay? You need to know what you feel and what you don't feel and what's going on, and you need to be able to monitor how your body is responding to the treatment that you're doing, okay? That being said, you're not an expert. Even experts take a long time to get these palpation skills, okay? I train a lot of professionals, and it doesn't come easy. So, but that being said, there's still a lot to learn about what you're going to feel, okay? I'm not going to actually do the DR check here because I have several videos that do the DR check, but I'm going to talk about what you feel and kind of why we do it this way. We don't have you do a full crunch, which a lot of doctors and PTs were taught that in medical school and PT school, to come all the way up. And when people ask us this question all the time is, if I come all the way up, the diastasis goes away. The muscles kind of come together. So why wouldn't I do a crunch to close it up? Well, it's a great question. But as you crunch forward, the rectus abdominis, the outer muscles bulge, and they kind of fill in a gap. If it's a small gap, they'll fill in that gap. But it still is putting a lot of pressure out on the tummy, and it's not a functionally relevant position that you live in or should be living in all the time. So over time, it's still putting a lot of pressure. And then when you come back up to like a standing position or a sitting position, and the muscles are not pushing into that gap, then the gap is still exposed and your organs can still rest out, or your belly can still push out through that. So it's not the most accurate way to tell what's going on. It's also not a very good way to have an objective measurement that's the same each time. When you check the way we instruct, where you lay down and you barely lift your head up and just lift up enough to feel the initial activation of the muscles, that's going to give you a good starting point every time you check. You don't have to worry, did I come up high? How high did I come up last time? You don't have to worry about any of that, okay? So you can know that you have a consistent measurement, all right? So that being said, we don't encourage you to check a ton, and we don't encourage you to dig around in your tummy. This is very vulnerable connective tissue. You have an injury, okay? So you need to be really gentle and patient with yourself, okay? So we want you to not use the tips of your fingers, but the pads of your fingers when you press in, and then you feel kind of the hugging. Now, there's a couple of different things that people will say. They'll say, I don't feel the separation at all. I can't feel the edges. So there's a couple things that could be going on if you don't feel the edges. If you don't feel the edges, one, maybe your diastasis is not as bad as you thought. Maybe it's really shallow and it's close together, and it's more functional core weakness issues where the connective tissue is actually feeling okay, but the muscles, the corset muscles, are inactive, which in that case, you still need functional core rehab. You just don't have the same connective tissue thing. Now, if that doesn't resonate with you, if you press in and you're like, oh my gosh, I can't feel the borders, but I can feel all my organs because it's clearly really, really, really thin. You could have just a really thin, deflated, weak abdominal wall all the way across. Or you could have a really thin abdominal wall and a separation. And sometimes you have to put more than one finger in. Sometimes you have to come up higher at first to feel the activation of the muscles and then go down and feel where you just first feel it. Sometimes you have to really engage more than you think to get those muscles to activate because they've been so inactive. So that's something. Sometimes your body feels like it's more like it's wide, but it's more shallow, like a long kind of puddle versus a trench. Okay. And that's okay. But what that tells us when it's kind of like my muscles are here and it's like this shallow kind of just cave in the middle, that's just telling us that we really need to beef up this corset muscle. And as we do that, it's going to pull the two sides together, and the connective tissue is going to start to overlap and kind of come together and revascularize and get stronger and more nutrition in there and get stronger and stronger and stronger. Okay, so if we can stop pushing out on it and we can pull the muscles together and reinforce that over and over again throughout your day, your body really prefers that position. It's much more protected and supportive, and it's how your body functions best. So it's going to crave that strong posture if you can give it that feedback. All right. Now let's say you feel the borders, they bulge up and it's like such a trench, but you can't tell like how far down. It really doesn't matter. If you feel that trench where the rectus abdominis is really, really tight, and it's a gap, like an easy gap that you feel, then it's already deep. If you feel that extreme difference. And when we are checking shallow, medium, and deep, we're really just trying to go like, how thin is the connective tissue? And that's valuable information for you because you want to know how important it is to protect this area. Like, it's always important, but if it's really thin, then splinting is going to be important in the beginning. You want to avoid, your kids pushing their feet in there. You want to really be intentional about using your hand to support your tummy when you're doing stuff that would have pushed out, to really encourage it to come in. We just really want to protect and help that connective tissue to get as much blood flow and sensory feedback as possible to start the healing process. The other thing to know about that really tight borders is that your rectus abdominis is overdeveloped or overcompensating. And in that case, sometimes that tightness can keep the diastasis from coming together. And it's partly from crunches and stuff, but it also is from crunched-like postures, collapsed-like postures that are putting you in a crunch all day long. And these muscles are trying desperately to stabilize you. And in our rehab process, we talk about abdominal massage and specifically releasing the rectus abdominis as you get stronger. You don't want to release it without giving your body a better strategy. But you know that that's going to be part of your process, is to strengthen the corset and release this rectus abdominis. The other thing that people will say is like, oh, it feels really bad below my belly button. And at my belly button, but it's okay up here. Or opposite, it's really bad above my belly button, it's okay at my belly button, it's okay below, or I just feel at my belly button, the upper and lower isn't a big deal. So you can have all three in any combination. You could have a trench that goes all the way up and down, like I had, 6 fingers all the way up and down I could fit in. But then as mine healed, the lower and the upper started to heal, and then the belly button was the last part, and the belly button slowly, and now it's all closed. Okay, so the deepest spot was my belly button, but for me, I had a trench all the way up and down. When you have, it's normal, somewhat normal. Everybody's a little bit different, but you want to feel what you feel. If it's wider at the top, it's almost always related to bracing, bearing down, rib flaring, maybe tail lifting, and straining, that kind of stuff. And upper back pain, mid back pain is really related there. Men tend to be more up at the top. If it's really down low, women tend to have it lower, especially if they've had multiple pregnancies, or if they're also having pelvic floor issues, SI joint issues, pubic bone issues, intestinal issues, menstrual cycle issues, low back pain. All is connected to that lower separation. It's really common for women to be really separated at the belly button because that's the weakest link. We all started out with a diastasis when we were born for the umbilical cord to go through. So that's the weakest link for most of us, and for pregnancy pushes out on that weak link. And so a lot of times the belly button is the last place to kind of heal up. It's the deepest part of the puddle, so it absorbs the slowest. And so recognizing that all of that just helps you to understand yourself. Remember what I said at the beginning, the self-check is part of a self-evaluation of what's really going on in my body. What am I feeling? What could be happening here, and what do my focuses need to be? And recognizing that there is hope. It can be a bit overwhelming to start looking at things that we train ourselves to ignore. It can be a little daunting, but it's just information gathering. And if you don't know where you're starting, it's hard to know the next step to take. And it can be a little discouraging and frustrating because sometimes we avoid things, and when we finally look at it, it feels like a lot. But we're here to tell you that there's hope. We work with clients around the world, and this is our specialty, and it doesn't matter how severe your diastasis is, how long you've been living with it, and really honestly how much advice you've been given to get just a surgery, and how many different rehab processes that you maybe have tried. If you're still struggling with a diastasis, there is hope. We can help you. We have a really effective approach. It's very different than what people think, and you could totally do it. Okay, so check out thetummyteam.com. We have lots more information about diastasis recti. We have a lot more information about our online programs, our approach. We're happy to answer your questions. We want you to make an informed decision, and we want you to know that there are resources for you. Okay, so hopefully this video helped you to problem solve a little bit of what's going on when you're checking yourself. Again, don't dig around in there. Be gentle, and don't check every day. You know, maybe check once, and then maybe check again in like 6 to 8 weeks, okay? So that you're not causing damage when you're trying to heal, all right? All right, let us know if you have any more questions. Thanks so much.